Emanuele Capobianco, who is the head of health and care at the Red Cross and Red Crescent Societies. Thank you so much for joining us on the program. Now, we're seeing countries across the globe taking various measures to essentially stop the spread of this virus. What is the Red Cross doing to help defeat this epidemic?
So the Red Cross is on the ground in the countries where the epidemic is raging, is in Iran, has been in China, is in South Korea, is active in Italy, with intervention at various levels. We have been screening people, we have been supporting the transport of people in specific high biocontainment ambulances. We are supporting the personnel that is taking care of sick people. We are supporting those families that are quarantined wherever they are, those individuals that are in isolation, with a lot of social support and psychological support, very important at this moment. We are also extremely active in providing the right information to people who are scared, who want to know what to do to defend themselves and their communities to the virus.
So what should they do, Emanuele?
They should do, first, remain very informed of what is happening, understanding what the authorities are saying and acting responsibly. Second, they should take simple precautions like washing their hands very often and teaching their family members, their friends to do the same. They should be avoiding crowded places, particularly in areas where we know that there is infections going. They should keep a certain distance when they talk to people, and they should realize, and this is very important, that all these difficult measures to adopt are for the benefit of the larger community. If we work together, each citizen as a responsible citizen, we can eventually win this outbreak. If we don't, then this outbreak will go ahead, and the risk will be for hospitals to be overwhelmed with patients and having a higher mortality for those patients that have coronavirus, but also huge impacts on the ability of hospitals to respond to other diseases that people may have. So this is a very important public health emergency where everyone is absolutely responsible, not only for his or her own health, but for the health of all the communities around themselves.
So how effective do you think these precautions that are being taken are?
Well, these precautions are certainly very effective. Now, we need to look at what, for instance, Italy is putting in place. Very drastic measures, closures of cinemas, closures of restaurants, closure of venues. And we talk about funerals being banned, and also weddings. These are very heavy measures, but they are actually helpful to reduce the spread of the infection. By reducing the spread of the infection, the number of cases will hopefully over time diminish, and the risk of overburdening the health systems will decrease. This is the goal at the moment, making sure that the hospitals and the health systems remain functional at this very point in time. And the measures that are being taken in Italy will probably need to be taken by other countries in the near future. So everyone now, every single country in the world, needs to move and prepare particularly the health system, but also prepare the communities for what is likely to come.
All right, Emanuele Capobianco, thank you so much for that insight.